Now, how do we begin treating pelvic floor disorders?
So the first line is to get a referral from your physician. There are other problems that can mimic or cause pelvic floor dysfunction, like infections, and so you have to have that ruled out before you'll come and see a therapist like me.
Now, what about medications? Is that part of the treatment?
So as a physical therapist, I don't prescribe any medications, but there are medications that can be very effective in treating pelvic floor disorders.
Okay.
So things like overactive bladder, there are medications for that. Obviously, if you have pelvic pain, there are all kinds of different medications that we can use to help with pain.
But now a patient comes to you to get their pelvic floor therapy. So can we talk about what kind of pelvic floor exercises or therapies are given to a patient? Just an overview, because I know that we're going to get into that more in depth.
Sure. So as a physical therapist, one of my primary tools is exercise. It's important to improve function through healthy movement. And even though we can't see the movement in the pelvic floor, its success and its health is very important for all of these control mechanisms, for urine, for fecal control, and for sexual function. So the exercise that we know for the pelvic floor is basically the Kegel exercise. And that people have read about it in women's magazines. It's been around for a long time. Dr. Kegel was an OBGYN, and he worked in the 1940s. Hence, he named this exercise. And we know that strengthening those muscles, particularly after delivering a baby, helps control
They're being
those.
told, do those Kegels everywhere.
Do your Kegels, exactly.
Okay, so I have another question, though. Let's say surgery. Is that ever an option, though, before the therapy? Or do you see patients who've had surgery and then now are going to therapy?
So I see both. I see both.
Okay.
My preference would be that every woman who is considering surgery for stress incontinence have a course of physical therapy beforehand. Because if you can strengthen the muscles and control your symptoms, that's always better than having a surgical procedure. But the surgery is not right for everybody, and there are some problems that physical therapy can't solve, and the surgery is a great choice for those women.